Hello, everyone. I'm Tom Davis, Global Sector Lead for Health and Nutrition for World Vision. So we have plenty of evidence now that depression is a major unaddressed problem in most of the places in which we work. For example, we know that depression is not just a problem in industrialized countries. The prevalence of maternal depression is between about 15 and 57%, depending on the country studied. We know that women suffer twice as much depression of men, with mothers at an even greater risk. Men sometimes express depression as anger, by the way. And maternal depression in the perinatal period is linked to a wide range of adverse child outcomes, including compromised physical and cognitive development, behavioral difficulties, and increased risk for later common mental disorders in children. We also know that postnatal depression has a significant negative impact on behaviors such as breastfeeding and on child development, such as delayed psychosocial development and behavior. But depression doesn't just affect behavior. We know that infants of mothers with depressive symptoms have a higher odds of being stunted, and that the causal relationship between household food security and depression is bidirectional. That is, experiencing food insecurity makes it more likely that you'll become depressed, but independently, being depressed makes it more likely that you'll become food insecure. We also have other studies that show compromised parenting behaviors are linked with depression. Just understanding the suffering that goes on with depression should be enough reason that we should want to intervene. But we now have multiple studies showing that this linkage between maternal depression and growth of the child is very real. We know that maternal depression in the prenatal and postnatal periods predicts poor growth and a higher risk of diarrhea in infants. So watch, people, listen up. And that there are strong associations between depression and higher rates of preterm birth, low birth weight, and restricted fetal growth. Children of depressed women also have lower completion of recommended immunizations. Meanwhile, providing therapy for parents with depression can improve children's cognitive development and increase mothers' and fathers' play activities with the child. There are numerous studies linking maternal depression to child growth. Major depression in the postpartum period and current major depression are associated with malnutrition in the child. And the most striking finding for me is from Pamela Serkan's meta-analysis in 2014, which found that elimination of maternal depression could result in a reduction in stunting of 23 to 29%. She concluded our findings indicate that a reduction in the incidence of maternal depressive symptoms in developing countries would not only have a beneficial effect on mothers, but would also improve child growth substantially. Maternal depression is thought to affect adolescents as well. This graph shows the stress hormone levels of adolescents whose mothers were depressed when they were an infant and for mothers who were not depressed when they were an infant. Let's remember that mental health interventions are even more needed now during COVID-19. This graph shows the recent self-reported stress levels in two regions of Ethiopia, with about 35% of people in Amhara and over 85% of people in Oromia, where there's a lot of social unrest, reporting the highest level of stress possible. Note that a World Vision Uganda project final evaluation found that there was also a reduction in risk-taking behavior and suicidal thoughts amongst IPTG group members from a pre-assessment level of about 26% to a post of about only 5%. This is very important during COVID, where we have seen suicidal ideation going up dramatically. And we could do something about caregiver mental health. A 2013 systematic review of 13 clinical trials of structured interventions for perinatal depression in lower and middle-income countries showed feasibility and effectiveness. The WHO concluded in 2013 from research conducted in China, Jamaica, Pakistan, South Africa, and Uganda that depression in mothers can be affordably treated in developing countries using a variety of methods, such as social support, group therapy, or home visits. And we now know that combining maternal and child health programs with support for positive parenting and psychosocial support for caregivers is likely to have long-term benefits on children's health and development and maternal mental health outcomes. I'll now pass over to my amazing colleague and friend, Paul Bolton, who will tell us about his work in USA focusing on caregiver mental health.